All right, all right. Good afternoon, good evening, good morning. Wow, it's been a while. I've not appeared online for a while, and I think I'm excited to be here today. Good to see everybody, and we have all our panelists in the house, and of course, we have the representative uh, from Nigeria. He just celebrated his birthday and he smiles just like a politician. So don't worry, you will see him very, very shortly. So I'm going to be bringing our guests to introduce themselves to you one after the other. But please do us a favor. Make sure you like this video. Make sure you subscribe to this YouTube channel if you are watching on YouTube and share this video with someone. I mean, this people have volunteered their time themselves to come and teach you, to come and lecture you, to come and expose the knowledge to you, and all you can just do in return is just 5 seconds. Click on that button, share it now, and I believe someone will thank you for it. So let's dive in, and I'm going to be bringing in Dr. Jacqueline as she introduces herself to you, our audience. Over to you, Dr. Jacqueline.
Hello. So yes, my name is Jacqueline Evans. I'm an optometrist in Denver, Colorado. And so my specialty is primary care, comprehensive eye exams, but I'm definitely very, very interested in the telehealth aspect of things. And, I'm currently expanding my practices to include lots of locations to serve the underserved. So thank you.
Awesome. And Dr. Chris, over to you.
Hello, viewers. It's my pleasure to welcome you all to this edition. I am an optometrist with 8 years post-university experience, and I've been into primary care optometry since after my graduation. So it's going to be a wonderful time with you today, sharing on some of these basic important matters that that concerns all of us. Thank you.
Awesome. And before I bring in our guest, I think it's good all of us will sing happy birthday song to him. Let's go. 1, 2, go. Happy birthday to you.
Happy birthday to you.
Happy birthday.
Happy birthday. Happy birthday to you.
Over to you. Introduce yourself to our audience.
Thank you very much, Dr. Manuel. I'm so grateful. Thank you, the panelists, for that wonderful song. I thank God and I thank you, people. Yeah, like I've always said, Bright Ugochukwu is my name. I represent David Omenoko Foundation here in Nigeria, and I'm glad to be on the show to present most of our doings in the last couple of months. Thank you so much.
Awesome. And over to you, the co-host, Mr. Alex, as you introduce yourself.
My name is Alex Mwahiri. I'm co-hosting with him in this program. You're welcome.
And awesome. With standing ovation while we remain seated. Join me as I welcome the host of this show. Sometimes I don't even know how to introduce her, but join me as I welcome Dr. Keyna Omeneko as she introduces today's topic.
Hello, everyone. Welcome back to this episode. We are going to continue our conversation from last time. It's been about a month since we treated this important sense organ in our body, the eyes. It was a wonderful show. If you missed it, please go back and rewatch it. But we will try today to do a little synopsis of what we did last time, and yet to continue on the important aspects of it, like the treatment and what we need to do for preventive health for the eyes. And if your eyes already have some conditions, what you need to do to prevent it from getting worse. And I'm glad to have Dr. Jackie and Dr. Christopher back with us today. And I thank all the other panelists and the host and the co-host for bringing this show to life again today. Welcome, our viewers.
All right, all right. And I think before I hand over to Mr. Alex as he paddles the canoe of this event today, I think it's good that we kind of summarize what we treated last 3 or 4 weeks so that someone that is watching today's episode will be able to operate at the same speed with us. So I'm going to give Dr. Chris and Dr. Jacqueline just whatever you can recap from what we discussed last time, just 1 minute each, then we begin to dive in.
Yeah, I think we covered a good deal. I think one of the topics was, what's the importance of basically, regular eye exams. I remember Dr. Manuel talking about, glaucoma, a good deal, which actually tends to be one of the larger conditions that's more prevalent for people of African descent. So that is definitely something that I would love to continue talking about. But yeah, we talked about quite a bit.
Awesome, awesome. And Dr. Jacqueline, if you could just, Dr. Chris, if you could just summarize also.
Yes, the last time we had a good time talking about what a healthy vision constituted, what age-related changes that people notice as they grow older, and we also talked about nutritional modifications that can help people to promote eye health or maintain eye health by eating healthy. So these are some of the things that I can recall that we talked about. Yeah.
All right, all right. While that was going on, we had an august guest. He's not a guest speaker. He's actually one of the main organizers, one of the main brain behind this show. I wasn't expecting him, but I mean, he functioned in all areas, so I won't be surprised if he has something to share also in this topic today. So let him just go ahead and say hello to our viewers. Dr. Law, over to you.
Yeah, hello viewers. I'm Dr. Law Sando. I'm back here today to support this very important topic in Keyna Health Show. Good evening, everybody.
Awesome, awesome, awesome. He's not on the flyer, so you go give me 1 minute to go back and add into the flyer. Anyway, let's just continue. Okay, Mr. Alex, over to you.
Dr. Jacqueline, it is good for us to kick off again and remind everybody what they consider to be a healthy vision, and then the difference between a healthy vision, what you mean by vision and eyesight. And then Dr. Emmanuel will look at the features and signs of a healthy vision. Then we can go from there. Recap it. You can just recap it. So
absolutely, yeah. So eyesight and vision are actually pretty interchangeable terms. So it's how well you see without glasses, but we can also measure how well somebody sees with corrective lenses such as glasses or contacts. So that is, the definition of those two, and they can be interchanged. In terms of healthy vision, we have to look a lot of times at the predispositions that certain individuals have, different races oftentimes, or different genetic issues that might be running in their family that can lend themselves to unhealthy vision. So that would include conditions like macular degeneration, glaucoma, diabetic retinopathy, hypertensive retinopathy. Any retinopathy are conditions that will affect the retina that are, not normal, so to speak, right? They're abnormal. So with that being said, healthy vision is really a translation or a spillover of healthy bodies oftentimes. So if your blood pressure and blood sugar are under control, then we don't have the situation usually where the eye is being impacted. If they are not controlled, then we will see signs of those conditions in the eyes. causing unhealthy vision. But there are a multitude of conditions that can plague the eye that are outside of those that affect the body. But it is of paramount importance that those conditions are really monitored through regular eye exams and detected through those eye exams. So that is really how we get to a place of healthy vision in general.
Yeah, Emmanuel, over to you.
Emmanuel or Chris?
Chris Emmanuel.
Chris, yes.
Go ahead.
Okay, so some of the signs of poor vision that most people complain about. Some people may complain about having blurred vision, that they cannot see objects that are far away or closer. Depending on the distance the target is. Some patients can also complain of double vision. Some others can complain of eye strain. Some people can complain of hazy vision or seeing floaters in their field of view, seeing things, flying around the field of view. And some other people can also complain that they are seeing fuzziness. You can also have other people telling you they have headaches when they read or when they try to, walk in the sun. Some people may also have symptoms like squinting. They can try to squint their eyes, like the eyelids, when they're trying to focus on an object or an individual or something, of target, of importance. Some also may have things like distorted vision, which usually indicates more of a deeper problem at the back of the eyes, affecting the macula and the fovea and the retina, things like um, this vision being distorted, people having halos, around bright light. When you look at bright light, you feel like you're seeing halos, around it. So these are some of the symptoms that most people that present for eye consultations. These are some of the symptoms that that you can have, that will tell you that something is wrong with your vision and that you need to consult an eye specialist, to know exactly what to do about it. So also when people have a need for more brighter light, like in a normal situation where everybody could read, but someone is still struggling to see things, is needing more light to see something, especially to read, this can also be indicative of a serious eye condition. And also, when you get into a room when that is lighted, and you feel like the light is too sensitive for you when it's not the same for everybody, like being photosensitive, that's photosensitivity, photophobia or photosensitivity. So these are the things, the signs that we can, see. You can also have a weaker vision at night than you have during the day. Although generally, people tend to see well during the days, but when you have much, much weaker vision at night, particularly when you're driving, it can also be a trouble for you. It can be a signal for you to, check your eyes. Yep.
Awesome. Awesome. Before Mr. Alex continues, I just want to, but by the way, thank you so much, Dr. Chris, for that insight. So once you are spotlighted as a speaker, for instance, this is me. So once I exit that particular spotlight, so what the timekeeper is saying is that, okay, begin to tidy up. So it will really, really help us to be able to navigate through these topics. And also, because we have the representative of David Omeneko Foundation in the house, it therefore means that the internet in Nigeria, the electricity in Nigeria, and every other factor in Nigeria is still cooperating with us. That is why he's still here with us. So I think it's good we attend to him before all those things might begin to work against. We don't pray for it. So this particular show, what many people do not know is that is a partnership between David Omeneko Foundation and Christoph Family Clinic. So this also is to showcase what David Domenico Foundation is doing. This time of last year, there was a fundraise by some of the partners, and which I believe very soon also there will be another time to call on you, our viewers, because this is not a Santa event, even though this is a free event, but at the same time, something have to, keep, supporting the cause, the mission of David Domenico Foundation. So we have a Dr. Bright in the house to kind of tell us what the foundation is doing in relative to what we are discussing. And over to you, Dr. Bright.
Okay. Thank you very much, Dr. Emmanuel. Yeah, the topic at hand, healthy vision, cannot be overemphasized because in the foundation, we have discovered that 70% of complaints we receive in each program borders on the eye. And the foundation has been moving from a personal pocket, and that is why we keep appealing to people to help us reach these people that need some of these things. Take, for example, David Domenico Foundation has a calendar that runs from February to December. We'll start with our normal World Cancer Day, cancer screening, both prostate, colorectal, and both cancer, colorectal, breast, and prostate. Each of these rallies, people will come to ask you, do you not have anything to do with our eye and we are going blind? What do we do? So the chief executive officer deemed it fit to do the little she can by distributing free reading glasses to some of these people, the much we can. And we also accept referrals and also fund it. Is so heavy on the foundation, and we can only do what we need to do. After that February, we go to March, where we celebrate the World Colorectal Cancer Month. We provide free fecal occult for people, and also awareness and other forms of medications we administer during the March program. We also encounter this problem of eye. It's really bugging us here. Then the calendar pushes also to April and May. Here in Nigeria, the Christian community celebrates their normal Fathers and Mothers Day within these 2 months. So the foundation partners with religious organizations to provide cancer screening as well as reading glasses to people. And we keep on having a lot of testimonials on these people. I can assure you, each of the program, you cannot distribute not less than at least 2,000 reading glasses. And each time you go, you see people trooping out. We want more. At least we can pick our beans in the kitchen. We can at least pray with our small Bible. We can at least read what the television is saying. So we're having much of those testimonials. Then after June, the next program we used to have here is August meeting, where we reach out to so many women in different parts of the state and different parts of the country. Dr. Emmanuel has joined us in one of our statewide program in August, where we taught almost all the 27 local governments in this state, distributing free reading glasses and also taking referral for those who need to be refracted in the clinic. After August, we prepare for our heavy program again in October, whereby we release our GoFundMe link, where we seek for support because it has been funded from a sole pocket from the chief executive officer, which is weighing so much down. October is a major event where we screen women, especially indigent women, for breast cancer. That's the program we run. We call it mammogram. We screen people, women, for breast cancer through the mammogram machine. It's a very major program, very capital intensive, and we are trying to see what we can do, at least to say no to cancer. Then after that program, we now wrap it up with our all-white medical mission in December, whereby various ailments, both cancer, diabetes, and all we've been treating on this Keyna Health Show since since the year began. That is when we now have them practical and we now give medications. So thank you so much, sir.
Wow, 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 wow. I'm just I'm dazed with that report, and for some of us also viewers, we might not also know that this show actually started talking about cancer. It was, I mean, that was actually the motivation. That was how it started before we started diversifying to other aspects of our health. And I mean, Dr. Bright, thank you so much for that report. I don't know if the CEO or Mr. Alex wants to add to what he has shared before we continue with today's topic.
I think it was very comprehensive. Let's go ahead.
Okay, awesome. Over to you.
All right. Dr. Mr. Alex, before you move on, Dr. Chris mentioned something about halos. I want to Dr. Jackie to explain a little more what halos are so that people can understand what they're talking about. And while you're treating that, could you also touch why it's important to have what is the 2020 vision and why it's important to have a healthy vision?
Absolutely. So halos will usually be the result of a refractive error, meaning that somebody has a prescription that is often not being corrected for. The more pronounced halos will present themselves in the evening, at dusk, at nighttime when you're driving, and people will tend to talk about these halos around, say, car lights at night, street lights, that sort of thing. Most commonly, this indicates that somebody likely has astigmatism, which is a very fancy word to simply say that the front of the eye is more curvy than the average eye. So there's one meridian that is steeper. It affects the way that light refracts off of the eye or bounces off of the eye. Therefore, people will see halos and a diffraction scattering of light. When they have the proper correction in front of them, those halos are usually reduced significantly. Now, another reason for halos that's very common is the advancement of cataracts in the eye. So a cataract is what most people will get after age 50 in some shape or form. It is the lens within the eye that's right in your pupil that will get very yellow and very dirty over time. That yellowing of that lens happens due to sun exposure over many years. And typically people who live in areas where there is a lot of sunlight will have them more prematurely. So that is really what the halos represent. And those cataracts will scatter lights in different directions a lot more. So scattering or haloing of lights does indicate that somebody needs to be seen by a doctor, typically. So the 20-20-20 jargon, I would love for Dr. Emmanuel to explain that. I think he's very, very skilled in talking about that. It's it's a very complicated mathematical thing about 20 feet distance and all that good stuff. But typically that's our standard of how well we can correct somebody to. So if somebody is correctable with glasses to 20/20, that's really what we consider to be very good, perfect vision. We care about what somebody is best corrected to with corrective lenses, not necessarily what they see without the corrective lenses. So, but if you want the math behind it, I think he's your guy.
Okay, Dr. Law Sondo, you've been in practice, and I'm sure people have been coming to you with eye complaints. So what do you normally do when they come? And Dr. Emmanuel also talked about, or rather Dr. Jacqueline talked about diabetes, and they talked about high blood pressure. So what is your experience? How has this impacted on your practice, and what really have you been doing when you encounter this as a generalist?
Yes, as part of an annual physical, for any patient that comes in that has not done his annual physical every year, it is recommended that every year your patients go through annual physical, including drawing blood and checking their basic eyesight and many other things, and then know whether they need referrals to specialist who will take care of anything you find at that stage. That's the basic principle of primary care, which we get involved in. For anybody that is diabetic, we recommend that the person goes to have an eye examination every year, because something like diabetes and even high blood pressure can cause a lot of damage to the eye. It can cause blindness. Both high blood pressure and diabetes can do that. So it is very, very important that every primary care provider will make sure that any patient that has those conditions see their eye doctor and have eye examination at least once every year. So when you do the snail test and find out that the person is deficient in his ability to have basic sight that can make him function, then you have to refer to either an ophthalmologist or eye clinic for examinations. And so they take it from there. Anything you observe that you cannot handle in the area of eyesight, you take to the doctors. Apart from my clinic, I have been going to medical missions for years in Nigeria, and I found out that most of the people that come for medical missions, their most important need would be about their eyes. As we grow older, we have problems with our eyes in so many forms. Some don't, though, but majority have some kind of diminished vision or the other, one way or the other. And the most common in which we get involved during the medical missions to Nigeria is the cataracts, because our people are exposed to very high, intense rays of the sun all the time. It appears it has effect on the lenses of the eyes, and they develop cataracts. And some of the times, when these cataracts
We lost him.
I think he froze.
and for some, it's just a little difference from what they used to see before. So those things are there. Most older people develop some kind of astigmatism. They neither see what is far very well or what is close very well. When they go into the room to adjust to the intensity of the light in the room to be able to see, it takes them some quite longer time. So these are certain changes that happen in the eye as we grow older, and it can happen to also people who have certain trauma to their eyes or in some of the exposures that can spoil some of their visions. So I can go on and say what pertains to the eyes in both the clinic and in the missions, but it is very important. One can say the eye is one of the most important organs of the body, because without the eye, I don't think the population of the world will be 1/4 what it is today, because most people will not be able to see food to eat or even carry out their daily activities or do other things. So the eye is very important. So high blood pressure and diabetes conditions, chronic conditions that should be managed very well, otherwise it will lead to blindness. Let me stop there so far and see what else, other questions you can ask me.
You've done very well. Thank you. Thank you so
You're
much
welcome.
for that. I know we have 30 minutes, and we really need to get into some other areas that we want our viewers to gain more knowledge today. Let's start treating the what are the basic methods of caring and improving the eye vision. What can people do to protect their eyes? Dr. Jackie or Dr. Christopher, whichever one wants to go first.
Dr. Jacqueline, you want to go first?
Oh, you can.
Anyway, about taking care of our eyes, is something that that can be achieved with taking care of our health generally. But there are specific there are specific nutritional requirements, that also help the eyes to stay healthy. And so, for us to keep our eyes healthy, I think it's important for us to uh, the um, the various health agencies across the world, the CDC, the Center for Disease Control, and the World Health Organization recommends that we protect our eyes from the ultraviolet rays of the sun. The ultraviolet rays of the sun that reaches the earth consists of two very dangerous rays, and one of them is the ultraviolet ray A and the ultraviolet ray B. So the ultraviolet ray A is the one that has the longest wavelength, that causes deep, degenerative and aging changes on the skin. They can actually penetrate the skin deeply and cause damages. The ultraviolet ray B is only 5% of UVB reaches the Earth's surface, and that's the most dangerous because it has short wavelength. So it can cause sunburns, and when it hits the eyes, it can damage a lot of important photoreceptors, at the back of the eyes. Of course, it begins with damage on the cornea, and then goes behind and and cause a lot of damage in the retina. So it's important that we protect our eyes. If you want to maintain a healthy eye, you need to protect your eyes from ultraviolet radiations. The next thing that it is important also is that we have to avoid certain practices, certain lifestyles, like smoking, because smoking goes a long way to causing oxidative stress to most of the very delicate tissues of the eyes. That is the ones that you can also find right at the back of the eyes, the macula, the retina, and the fovea. So it's also important for us to maintain proper diet, good healthy diets, and maintain very good weight, because while it is true that getting older exposes us to a number of risks, and to a risk to our eyes, uh, most people that are overweight or obese, and people who have a family history of certain eye conditions also are even more predisposed to having to being at risk of degenerative conditions in the eyes. So it's important for us to maintain healthy weight. It's important for us to avoid ultraviolet radiations. It's important for us to wear our glasses. It's important for us to eat healthy and eat the right foods that nourish the eyes, that nourish the eye pigments, like the berries, the red and green peppers, especially green vegetables, and red peppers. So all of these helps in nourishing the back of the eyes, maintaining the lutein and zeaxanthin eye health. The broccoli, the tomatoes, the spinach, and some juices also can help to keep your eyes, healthy over a long time. So it's these are some of the things that we need to do to maintain healthy eyes for a longer time. Thank
Wow.
Jacqueline, continue
So
from
when
there.
you say some juices, sorry, Mr. Alex, when you say some juices, because I think it's good we mention. So do you have names of some of those juices that could help?
You can have juices that you can get from guava, from berries. I mentioned some of the berries, some grapefruits, some grapes. Their fruits can also help to nourish the macula, and then you can also get from oranges, from carrots, the yellow and green fruits, the green vegetables and yellow fruits. That's the way we call it, because the yellow ones provide pigments we call carotenoids, and the green ones, nourish the macula, with helping to maintain the health of the lutein, in the macula. So these are, really very important, rich resources for the eyes if you really want to maintain efficient, eye health.
Okay, Dr. Jacqueline, continue. Let's hear from you.
Yes, absolutely. So, another thing that he really mentioned a lot, or actually mentioned smoking. Smoking is a very big deal because the back of the eye, it can, cause degeneration of a lot of the important areas of the macula and the retina. But one of the most common complaints that we have from patients is dry eye. And, it kind of goes hand in hand, a very obvious thing of, well, I'm smoking and the smoke is going directly to my eye. My eyes are very dry. Well, this is why. And one of the main symptoms of dry eye is going to be burning. That is a common complaint, but also excessive tearing. And it sounds very counterintuitive that the eyes would tear if they're dry, but essentially the eyes are not making the right type of tears. So they are literally just producing more of the water from the lacrimal gland because the oil component is missing, due to oftentimes like clogged glands around the eyelid margins that secrete the oil component. So that is going to be something that people will complain about an awful lot, that can be remedied by, going ahead and making some lifestyle changes, perhaps not smoking. That's a tall order for some people. But also, directing air conditioners and fans away from the eyes. When you're sleeping at night with a fan on the ceiling, sleeping with an eye mask, using eye drops like Refresh, Sustain. Those are really good natural lubricants that they're not natural, but they're lubricants that have a very high viscosity that allow the eyes to really be properly lubricated. So those lifestyle changes, just like Dr. Emmanuel just mentioned, are really, important. But I will say one of the main things that I will hear time and time again from patients is my eyes are constantly running water. But oftentimes they're not always willing or knowledgeable about the lifestyle changes that they should be making in order to help to remedy that. So.
Yeah, Jacqueline, sorry, you didn't talk about alcohol and the exercises. Is alcohol okay for the eyes?
Well, alcohol's not good for many things, but a good time, I think. But so, so a lot of things are going on, with alcohol. Your whole central nervous system is just kind of a little bit depressed, right? So the eyes are tied very closely to the brain through the optic nerve. So a lot of the things that alcohol is depressing in the brain is causing the eyes to not be able to focus as well. Now, when we talk about true alcohol toxicity, we're not necessarily talking about, you getting a little tipsy or the occasional drink here and there. Those aren't necessarily damaging to the eyes, but actual ethanol, people who are, actually like drinking straight alcohol, things like that, which, there are individuals, instances where that can happen, that can lead to instant blindness because the amount of alcohol content is so high that it literally will just like kill the optic nerve. And that's a very extreme circumstance. But, is the occasional drinking here and there damaging to the vision? No. Excessive alcohol consumption is, though. And it will cause, a very large delay in visual perception and visual information being perceived, which is why, along with everything else, you shouldn't be drinking and driving, right? Because the vision is not good, but also the response time, everything is just slow. So the muscles in the eyes are just not working as they should.
Wow.
Yes. Well, another quick thing about maintaining a good eye health is trying to avoid a strain by applying the 20-20-20 rule, which says that after every 20 minutes of task, either you're working on a computer or you're reading a book or you're doing something, as after every 20 minutes you look 20 feet away from that task, and then you do that for 20 seconds. 20 minutes, look 20 feet away for 20 seconds. That helps to reduce eye strain. The eye strain that, like works to, make the eye muscles weak. Because part of what the alcohol does is weaken eye muscles and, make coordination of the eyeballs difficult for, the patient. So when you talk about somebody who takes alcohol seeing double, it's because the eyes are not coordinating. The eye muscles, like Dr. Jacqueline said, are weakened at that point. And so the eyes cannot coordinate themselves. And so when one is seeing one image, this one is seeing another image. And then it's difficult for the brain to, properly process the information, and that makes it worse. That makes vision worse for the alcoholic. So yes, 20-20-20 rule is very, very important in reducing eye strain. Yes, for everybody.
So along with that 20-20 rule, I'd like to add, this is often going to be applied most closely for people who are on electronic devices, computers, that sort of thing. And I think it ties into one of our questions that we have here, which is, is it advisable to wear glasses even if your sight is quite good? Which we get a lot of young people or people in their 20s and 30s that come in and say, I see fine, but my eyes are just so tired at the computer. Well, what they don't know is that there's often a residual prescription that we will find that allows us to prescribe a pair of glasses that will relax the eyes when they are performing these very tedious, up close digital activities. And in addition to us finding a prescription, oftentimes, even if we don't find a prescription, what we will now prescribe is blue light blocker glasses. Okay, very, very important in blocking the blue lights that are emitted from the phones, the computers, and the tablets that will cause a lot of tired eyes and fatigue. And the effect is additive. So if you have the blue light blocker on your computer, it makes a whole lot of sense to still have it on the glasses so that you can work more efficiently for longer periods without being so tired. Okay, so that is, one of the things that people might fall into the trap of, well, I see fine, I don't really need glasses, I can see great, but my eyes do get tired. And that's usually a red flag that they do still need to come in because there is something for them to be prescribed that's going to help, their experience utilizing electronic devices dramatically.
Wow.
Okay, I think it's important for you to let us know. We've been told a lot about the importance of exercise. How does this apply to the eyes? How does exercise apply to the eyes? Doing exercise?
I think exercise is linked generally to good health practice, because a lot of things can, just get in under the skin, a lot of fatty tissues, especially the undesired low density lipoproteins, the triglycerides. So over a long period of time, when these accumulate, the cholesterol levels tend to rise. And of course, the eye has blood supply, and most of these things gets into the eye and could cause, some atherosclerosis and the hardening of blood vessels, when fatty tissues grow, underneath the blood vessels and all of that. So it's a myriad of, conditions that, that can result from not exercising and just allowing yourself to keep, keep adding weight and adding adding a lot of fat without, mechanism to, to burn them off. So what happens is that the eyes, gets its fair share of that accumulation that happens, because then you may have things like atherosclerosis that can affect the eye blood vessels that go into the eyes. It can shorten a lot of blood from entering the eyes, and can cause things like sudden loss of vision because the eyes are not getting enough blood supply. So exercise is pretty much very important, because when you exercise, you are burning off fats, especially the ones that are not, very that are not healthy for the body. And when you exercise as well, you kind of open up more channels for flow of blood to the eyes as well. So when the eye has increased blood supply, it can function properly. But when there is reduced blood supply to the eye, which is what exercise does, it helps to dilate. It helps, yes, make the blood vessels to dilate, and then more blood flows around without restriction, and yes, reaching the most important tissues like the macula and the retina, and helping them to function optimally. I don't know, Dr. Jacqueline, is there any other thing?
Yeah, absolutely. Absolutely. I was just about to say, yes, what he's saying is absolutely right. There's a couple different variations of what you might mean by exercise. So exercising the body is going to be very, very important for the eye. One of the most common things that we will see in older people is actually a blockage of a blood vessel in the eye that can lead to half of the retina full of blood or all of the retina full of blood. And when it's all of the retina full of blood, it's lights out. So basically, these are variations of a stroke in the eye. And something that we will see that is a very textbook classic thing that nobody wants to see is what's called a Hollenhorst plaque. And that is a very, very distinct blockage that is seen on a retinal examination. And at that point, what we'll typically do is refer a patient immediately to an urgent care or ER because they need what's called a carotid Doppler, because something along here in their body is blocked. And so that's what I say. The eye is an amazing mirror for the body and what's going on. And that's imminent danger that would be, happening. Yeah, their vision could be lost, but their life could also be lost. So we will see that in some instances. Now, other instances of exercise for the eye are people who have a squint or an eye turn. Those are individuals who have like a lazy eye that kind of wants to go out. And there are, vision therapy exercises that can be implemented in that patient for their care to be able for them to control their muscles in the eye. So there are exercise muscles that are specific for certain individuals that should be performed. But it's an interesting situation because there are some people that exercise the eyes in a different way that is not advisable, which is like staring at something or working really hard at something. And I actually tell them that the eye is a muscle, and like any muscle, the eye will fatigue if it's just kept in one position for a long time. You can't plank your eyes. They have to be able to actually relax a little bit. So exercise comes in a lot of different forms in the eyes and how it plays into the eye health. And it's very, specific per patient basis. So, but exercise in general is always a good idea for the eye.
Dr. Jackie, let me ask you, is there a specific regular exercises that we need to do for the eye, apart from general exercises?
I think what Manuel is talking about, the 20/20 rule, is really the main exercise. The eyes don't really, we're looking all the time at various things. So in reality, our muscles are getting quite a bit of exercise. But when it comes to certain tasks, in order for us to be able to continually focus appropriately without discomfort, without strain, then we do need to stop every 20 minutes, look 20 feet away for 20 seconds, or close the eye. But, the exercise component of the eye, there's some people that believe or have read somewhere that exercising the eye will prevent presbyopia, which is where around age 40 to 45, the muscles inside of the eye will anatomically naturally weaken. And therefore, you will need reading glasses, bifocals, that sort of thing. Nothing to really stave off or prevent that through exercise. But, the exercising the eyes in terms of looking away from an activity that you are, doing for a prolonged period of time is ideal.
Can I quickly ask these questions? I know time might not really permit us to get there. Now, I want to ask about self-medication, okay, for eyes. When we have allergies, we try to, we can just buy any eye drop and begin to possibly use it. And I've seen people, and I've used it myself before, that I would just cut onions and put on my eyes because you just want to shed tears. And you know that when you shed that will take care of all those. Or put something like methylator. or rub and put it on your eyes. And okay, once you know that, okay. So all those, do they have any danger to the eyes, and are they okay?
Yeah, not a good idea. I would say not advisable at all to employ those methods. Typically, what we will recommend for people are just over-the-counter antihistamine drops. The eyes are very specific and very localized, so taking a systemic antihistamine doesn't always affect the eyes in the same way. So there are drops that actually will apply that antihistamine drop directly to the eye. One of the ones that we have in the States here is Aloe or Pataday. And the success of those drops is quite good. So people will tend to, have allergies reduced dramatically. However, the side effect of those drops in any antihistamine is dryness. So therefore, they have to be oftentimes complemented with artificial tears as well. Now, again, we also see patients that will like to just use artificial tear. Well, use the antihistamine drops as if they were artificial tears, meaning they're just using them every day, all day, and that's just what they think they should be doing. But it's really not helpful. There's like a certain cutoff point where we want you to not use them all the time. Use them consistently for a week to 2 weeks, and then stop, because the allergen is then, been eliminated. Yeah. So, it can actually cause more detriment if they are used improperly than help. But save the Vicks menthol for your cold. No.
All right.
Yeah, those things like the onions and the rubs are particularly dangerous, because you could cause aberration, on the cornea, which will lead to very serious keratopathy. And you don't want to be in a hospital for any keratopathy. So it's important that you avoid them completely, because rubbing things, those are very harsh things. The onions and the liquid that comes out of it can be really very harsh for the cornea and the conjunctiva, and they can really irritate these tissues even more than you desired. So it's important that we avoid them completely. They are, they're dangerous to your corneas and to the outer tissues of your eyes. So just try to avoid using them, and use tears, artificial tears, like Jacqueline already said, antihistamines, and mast cell stabilizers. These are some of the agents that are also over the counter that you can get in the stores and use them. Yep.
All right, Mr. Alex.
Yeah, I think we're almost through. I wanted to ask again, in caring for the eyes, you people have told us a number of things to eat, what to avoid, and everything. I want to ask, there was a place I was reading, and they said all these eye lids that people put in their eyes, that they could be dangerous to the eyes. Can you
Eyelashes?
What are you talking about, Mr. Alex?
Eyelids.
Eyelashes?
Women put a lot
makeup?
of eyelids, they add a lot of things to the eye. So all these things they add, I understand that sometimes it can make people blind. I want you to confirm all the future.
No, they don't. But what I would say is that, we have, they don't interact particularly well oftentimes with contact lenses. So we will see patients coming in that will have debris of makeup on the contacts. It causes a lot of buildup, a very blurry film. There is a list that you can actually find that is on the back of a very popular contact lens magazine, Tyler's Quarterly, that gives a list of, compatible makeups with the contacts. Now, it's not foolproof. It's not going to be a miracle, but they tend to not leave that type of residue on the contacts. But, for some people, it's worth the price of the beauty, even if you can't see clearly. So it's a hard sell for a lot of people to say, listen, I really think you could go without this mascara. Never. They'd rather not see who's coming at them. They'd be caught without their mascara. But so, it is. But I wanted to just mention one thing on that note. We spoke a bit about the cataracts. And it's really, really important to realize that, cataracts are the leading cause of blindness in the developing world. Because there are not individuals always readily available to perform the surgery. So the access to care is limited. But also, I do realize that was great. I love it. Yeah, there's, that's just the new thing. Everybody wants to look, even me. Look at me. So, that's the glasses. My rule is don't let my lashes be long enough to touch the glasses. Right? But we still see a lot of resistance and hesitation amongst some of our patients that come in. And when we're in the States, we say this is a cataract surgery that can be easily performed. We're going to do a referral. And there's such fear. And I think the education has to be very, very at the forefront, of us educating our patients. This is a very straightforward procedure. It is literally life-saving. I mean, the alternative is going blind, right? And we are such in a blessed position that we have people to perform the surgery, and you would say no. And you still have patients that will say no because the education is not there. The fear prevails beyond the education. So I just think that, for all of you out there who might have access to care, if that time comes, if you live long enough, and I hope that everybody does, but if your doctor, your practitioner says, listen, you need cataract surgery, please do it. Okay, please do it. It is such a privilege and a blessing to have it done. And it is really, the risks are quite low nowadays. It is a marvelous surgery. So, that is something that always strikes me as very poignant, that somebody would refuse to do it based off of fear, or lack of education. But educating them on the other side of it, I think, is equally important of the consequence.
Awesome.
Wow.
It's been amazing. We episode, we have just 2 minutes more, but so somebody, what you're trying to say now is somebody like this now cannot wear glasses, right?
Oh
my God.
So if she wants to wear glasses, how would that anyway? So we need to tidy this up by just giving our 1 minute summary. I don't know if there's going to be another episode because it's like we've not really covered all of the questions, but I believe what we've covered also is enough to kind of do justice to this. But so from the last episode and to this episode, so if you are to just summarize to our audience just in 30 seconds to 1 minute what their take home needs to be, so what would that be? If there's no other question, so it's okay for us to jump to that.
Yes.
Okay, so Dr. Chris, so let's start with you.
Okay, so your eye health, your eye is very important part of your existence. You can virtually do nothing, like almost nothing, if you go blind. So it's important that, you take good care of your eyes by eating healthy, staying healthy, protecting your eyes from the sun rays, and making sure that you do some eye exercises that keeps the eyes, at optimal levels, so that even in old age, when significantly there is high risk of, decreased vision or, vision changes, you may still be able to maintain optimal vision, without having the need to do cataract surgeries or, have to replace some areas in the macula or in the retina, before you can see. So everybody out there, please take your eye as very important. It's like an apple. Make it like the apple of your eyes. It's the only thing that that can help you enhance the quality of the life that you have. So take care of it. Make sure you go for your eye examination every year to make sure that your eyes are in good health and in good shape. Thank you.
Awesome, Dr. Jacqueline.
Yeah, I think I think my cataract warning was really what I feel in its entirety. But yes, like Dr. Emmanuel said, I think going to the eye doctor should just be like going to your primary care doctor. There's so many things that we will see that can really save you a lot of harm to your overall health. I mean, one of the first signs oftentimes of diabetes and multiple sclerosis is through large, huge vision changes. And so don't ignore it. I mean, just treat it as if it is the utmost important thing. I mean, really, if anything is going on in your vision, try to get it resolved as quickly as possible, and also for your children. That's another thing we run into is a parent might not have bad vision, but their child does. They lost their glasses. It's been a year, they're not able to learn. They're not able to do and function the way that they should be. And it's a disservice. And I understand, financial situations are always different, but in order for them to live their best life, they have to be able to see their best. So.
Awesome. So, Mr. Alex, what do you say your take home is?
I think my take home is that people, if you want to enjoy a healthy eye, you have to avoid smoking. You have to eat good food. You have to eat healthy. You have to make sure you don't expose your eyes to very bright light. You have to take exercise, and eventually you need to avoid alcohol and eat those food that will grow the eyes. Thank you.
Awesome. I saw that Mr. Alex took a wonderful note there. In fact, he can teach this topic right now. Mr. Alex can teach this topic right now. Anyway, thank you so much. It's been a pleasure, and I've learned a lot in today's episode. So thank you so much, Dr. Emmanuel, Dr. Jacqueline. Thank you for your time, and of course,
thank you for having us.
Thank you
also for showing up. So over to you, the host of the show, as we tidy up today's show.
Wow, what another wonderful episode of Keyna Health Show. I want to thank Dr. Jackie and Dr. Chris for doing justice to this topic. And as we all have seen and heard, your eye is very critical for your daily living. You can practically not do much without your eyes. And it goes back to eating healthy, getting your annual exams. Both your physical well-being is important for your eye as well as your eye health. So please eat healthy, eat your fruits and your vegetables. Like Dr. Chris said, exercise regularly, go see your eye doctor every year, go see your primary care doctor every year, and we'll see you all healthy in the next show. Thank you.